If you are studying for NCLEX, you need to know the brain lobes because neuro questions often stop being hard once you know what each part of the brain is supposed to do. If you mix up speech, movement, vision, sensation, and balance, you can miss easy points. Let's make this simple. Let's start with the frontal lobe. The frontal lobe is the lobe of executive function. This is where you think about planning, organizing, problem solving, reasoning, and aspects of personality, behavior, and mood. It also contains two high-yield areas. The first is Broca's area, which controls expressive speech. That means it helps the person produce words. If Broca's area is damaged, the patient may understand language, but speech becomes slow, broken, or difficult to get out. The frontal lobe also contains the primary motor cortex, which controls voluntary movement. So if this area is injured, you may see motor weakness or trouble moving the opposite side of the body. Now let's move to the parietal lobe. The parietal lobe is mainly the sensory lobe. It processes touch, pressure, pain, and temperature. It also helps with body awareness, spatial attention, and parts of calculation and perception. So if a patient has trouble identifying sensation or understanding where their body is in space, think parietal lobe. Next is the temporal lobe. The temporal lobe is linked to hearing, memory, and language comprehension. This is where Wernicke's area is located. Wernicke's area controls receptive speech, which means understanding language. If Wernicke's area is damaged, the patient may speak fluently, but the words may not make sense, and they may not understand what is being said to them. The temporal lobe also helps store short and long-term memory and plays a role in auditory processing. Now let's look at the occipital lobe. The occipital lobe is the visual lobe. It processes visual input, so if a patient has changes in vision, difficulty recognizing visual information, or problems with visual perception, think occipital lobe. Next is the cerebellum. The cerebellum is not a cerebral lobe, but NCLEX loves to test it with the brain. Its main functions are balance, coordination, posture, and smooth movement. If the cerebellum is affected, the patient may have ataxia, poor coordination, or trouble with balance. And finally, the brainstem. The brainstem controls vital functions like consciousness, breathing, and heart rate. So when brainstem function is impaired, the problem can become life-threatening very fast. So here is the quick breakdown. Frontal lobe is equal to thinking, planning, behavior, speech production, movement. Parietal lobe, think sensory processing and body awareness. Temporal lobe, remember hearing, memory, language comprehension. Occipital lobe, think vision. Cerebellum, think balance and coordination. Brainstem, remember breathing, heart rate, consciousness. For NCLEX, match the symptom to the function. Trouble speaking? Think Broca's area. Trouble understanding language? Think Wernicke's area. Vision change? Think occipital. Balance problem? Think cerebellum. Loss of sensation or body awareness? Think parietal. Weak movement or poor planning? Think frontal. That is the pattern you need. Nursing students, stay focused, think safety, and pass the NCLEX.